Hi everybody, my name's Heather Gluyas and today I'm going to be talking to you about patient-centred care, or the patient-centred care module. But before I do this, I would really like to read you a short excerpt from an Australian journal, our College of Nursing journal, and I've just been reading this and it's so applicable to what we're going to be talking about that I thought I would share it with you. The author is describing the experience of two of her friends. One's 90 and one's 50, and both have chronic conditions with multiple morbidities. They require assistance in their homes with their ADLs. And when the author asked them if they received patient-centred care, they both stated it was just rhetoric. So she goes on to describe why they think this is. And I quote, "Their primary frustration is that the practitioners who deliver care at home, irrespective of the occupational group or care practice or the level of education or any other definable category, tend to dismiss the views of the person, client, patient receiving care. My friends clearly have capacity to make informed choices, yet it seems that a desire for self-determination is not facilitated or respected by the healthcare professionals. My friends regularly are told by carers what to do or what they should do and when to do it. After years of self-advocating for themselves, both friends have concluded that it is simply much easier to endure whatever unwelcome advice and care ideas or practices that are imposed on them without discussion. That way, the unpleasant encounter comes to a swift end." This is a sobering account, I think, and I fear is probably more common than we'd like to admit. Now, I'm sure all the people that were involved in providing that care had the best intentions and really did want to ensure that there was best patient outcomes. But they weren't providing patient-centred care. So let's talk about patient-centred care. I truly believe that most professionals, in fact all professionals, are passionately care about their patients and want good outcomes for their patients. But often the care that they're giving doesn't recognise the uniqueness, the values, the preferences, the background, all the experiences that the patient has. So what is patient-centred care? Well, patient-centred care has four aspects. It's providing emotional and physical care. It's fostering a positive relationship between the health practitioners and the patient. And it's sharing information and power and responsibility for decision making. And it's designing care processes so that they meet the patient's needs and continuity of care. And it all sounds pretty easy, and I'm sure that's what we would really all like to be doing. However, there are a lot of barriers. So this module, the patient-centred care module, focuses on barriers that get in the way of us, of healthcare practitioners, achieving patient-centred care. And then it goes on to identify strategies to overcome these barriers. I hope that you'll take up the challenge and commit to a paradigm of delivering patient-centred care. But if you're going to do this, you're going to need to put effort and understanding into understanding what the research is telling us about the system, the healthcare professionals, and patient barriers that prevent good patient-centred care. Once you have an understanding of what those barriers are, you can concentrate on identifying the behaviours that support patient-centred care. And then what I'm hoping is that you incorporate these into your practice. There are learning activities associated with the module, and hopefully they will assist you to increase your understanding in this area. So enjoy the module. I hope you get a lot from it. If you've got any questions or comments that you want to make, feel free to contact me. And enjoy the module.